Hello everyone. Today I start teaching mechanical ventilation to our second semester students in our program. So what I'm going to do with the HQ challenges, weekly I'll post a basic mechanical ventilation question, bringing us back to the basics. And the purpose of this is to help RT students that are currently in school that are struggling with some concepts to maybe try to clear those things up. Or if you're working on your TMC and CSE exams, this might be a good review for you, okay? So today we're going to talk about indications for positive pressure ventilation or indications for mechanical ventilation. Which of the following is not, okay, so that is our key word, which of the following is not an indication for positive pressure ventilation? Meaning all of these are except for one. We have to find the one exception. So let's just start with PF ratio. All right, the PF ratio is the PaO2, P little ao2, divided by the FiO2. What this tells us is how efficiently oxygen diffuses across the AC membrane. The lower this number is, the less efficient it is, basically meaning the more hypoxemia a person is going to have. So this is a very low number. So this is going to signify that this person is probably pretty hypoxic. So severe hypoxemia is an indication for mechanical ventilation. This is an indication. We're looking for the one that is not. All right, an MIP of -18. All right, MIP tells us about inspiratory muscle strength. If a person doesn't have adequate inspiratory muscle strength, they are not going to be able to sustain ventilation spontaneously. So our value that we need to remember is that MIP, that inspiratory muscle strength, needs to be, normal would be less than -20. And when I say less, normal should be like -40 or -80. This is -18. Anything that is greater than -20, meaning -19, -18, is an indication for mechanical ventilation. This person needs a vent. Vital capacity of 480 mLs. That's terrible. Okay, this person isn't able to take a deep breath, and if they can't breathe deep, if they don't have the muscle strength to do that, they're not going to sustain ventilation on their own. Vital capacity needs to be greater than 10 mLs per kilo. 480 mLs, that's really low. I am 5'6". My ideal body weight is 61 kilos. So my vital capacity, where it would be critical that I would need to go on the vent, would be less than 610. So can you see 480 is really, really low? This is an indication for mechanical ventilation. All right, then we come down to D, and the answer must be D. A PaCO2 of 78, and we're only looking at sheer numbers, 78, where they're not ventilating. This is for sure because that CO2 is excessively high. But the pH is 7.35. So just looking at these numbers, we can make the assumption that the bicarb has buffered for that extra CO2, stabilizing the pH. So this is a blood gas that is more than likely chronic ventilatory failure. And just by sheer numbers, this person does not need a ventilator because the body's compensating. So the reason that we don't need positive pressure ventilation is D. Okay, hope that helps. If you have any questions concerning indications of mechanical ventilation, I have a very inexpensive mini course on my website, respiratoryhq.com. See you soon.